she has nothing to do today, so she came here. She's from Pavia, Simone Porcelli Lab, yes, fantastic. And she will present, yes, the title is the same, effects of 4-week prehabilitation on physical performance in head and neck cancer patients. Preliminary result, right? Work in progress, preliminary result. Go ahead.
Thank you for the presentation. I'm Lisa, and now we're going to talk about prehabilitation in head and neck cancer patients. So, neoplastic disease can lead to physical performance limitation, and these limitations are caused from several factors. Above all, I just want to mention the cancer treatment that in their curative intent can affect healthy tissue and so bring to permanent damages. But fortunately, we know that exercise can have an impact on that, and it was proven to be a safe and feasible approach to reduce this limitation and also to reduce mortality, because at least in adult population. So as we see from this graph, the number of recreational physical activity hours per week is linked to a reduction in the hazard ratio for mortality, and that's very interesting. But all this study refers to the exercise that is done during and after treatment, and nowadays there is a growing interest also in the exercise performed before the starting of treatment, and that's called prehabilitation. So prehabilitation is the process that occurs between the moment of cancer diagnosis and the beginning of active treatment, with the aim of optimizing physical, nutritional, and psychological status to improve tolerance to therapy and quality of life. Its feasibility and efficacy so far is explored in different kinds of cancer, but is proven only for lung cancer before surgery, and we have some data in colon cancer patients, such as in this study from Moliner and colleagues, where we can see that rehabilitation was definitely superior than standard care in maintaining strength measured by head grip after colon cancer surgery. While in head and neck cancer patient data is limited, and it is limited also before other kind of treatments. It will be of particular interest to analyze and understand rehabilitation of this kind of cancer, because the patient often undergo severe fatigue, dysplasia, and weight loss, and also because the surgery is often a demolitive one and can bring together also emotional and physical burden. A multimodal rehabilitation approach for this patient will take into consideration not only exercise, nutrition and psychology as you would expect, but also the cessation of some unhealthy habits such as smoking. So the primary aim of this study is to analyze the feasibility of a multimodal rehabilitation approach in head and neck cancer patients, while the secondary aim is to assess its efficacy on physical performance. So that's what we're doing. Basically, cancer diagnosis, all of our patients are tested and evaluated under a clinical, physiological, nutritional, and psychological point of view. And these evaluations allow us to make an individualized and multimodal rehabilitation that takes 4 weeks. And then after these 4 weeks, they start treatment. The patient go through their oncological treatment journey, and then we see them again after the treatment. The patient can go back to, let's say, normal life, and then we see them again at 6-month follow-up. I will not get into the details of this, but I just want to stand out that the clinical evaluation takes into consideration also quality of life and treatment toxicity outcomes. So regarding the exercise testing part, we're testing cardiorespiratory fitness through Echolog test and 6-minute walk test. For those who are not familiar with the first test, it's basically a cycloergometer submaximal test in which we ask the participant to cycle at 2 different workloads for 4 minutes, and then we know the heart rate at the end of this bout. And thanks to the delta power output and the delta heart rate and other factors such as age and sex, there's a formula that allows us to estimate the VO2. Then we're also testing exercise performance through sit-to-stand and, how do I start this video? Not here. Anyway, sit-to-stand and stand-up and go. This would be a video of our participant performing the sit-to-stand. And finally, we're testing strength through hand grip and the isometric knee extension. During the 4 weeks of rehabilitation, we're asking our participants to come to the hospital 3 times a week to perform supervised sessions of training. 2 of them are strength sessions and 1 is an endurance interval training one. And then we also ask them to perform additional endurance sessions at home for 30 minutes a day on the non-training days. Here we have some photos of the participants performing the strength sessions, and let's get to the results. So, to this part of this slide, you see the participant characteristics. So far we recruited 11 participants out of 60. They're all males and they're mainly older adults, even though we have 2 guys in their 40s. And to the other part of the slide, you see how they're behaving. So how many strength sessions they're doing per week on average, and how many minutes of endurance training they're doing on average per week. So they're quite close to the recommendation. Not all of the participants accepted the in-person support, so out of the 8 that are actually coming to the hospital to perform the sessions with me, the adherence and the attendance was 82%. That's a good result. And importantly, no adverse events were registered during and after, during exercise testing and sessions. Diving a bit more into the more physiological aspects, you will see some graphs that looks like this. So the first time point is at cancer diagnosis, and then they slightly increase after the 4 weeks of training, then there is a slight decrease after treatments, and then they go back to let's say baseline more or less for all the tests we are doing. For cardiorespiratory fitness, however, there is no significant effect of time, meaning that the cardiorespiratory fitness was quite stable over time. We see, unfortunately, a significant effect for this test of exercise performance, with the latter worsening at the 3rd time point, which is after treatment. Last but not least, we also see an effect of time for hand grip test, but the post-hoc analysis revealed a significant increase thanks to rehabilitation, so we're actually happy. So to conclude, oncological rehabilitation is safe and feasible in head and neck cancer patients. We can say that 4 weeks of rehabilitation might be enough to maintain strength and cardiorespiratory fitness, but exercise performance. However, we should account for some limitations, of course, such as the sample size we see is very limited, but we're working on it, and the absence of a control group that is not allowing us to make any solid conclusion. Finally, I want to thank all the people who are working on this project. I want to thank Laura Lucati, who's the PI of this project, all the heads of the other units. I want to thank all of my colleagues who are here today to support me, and finally Simone Porcelli for adopting me as part of his lab. And with my favorite participants, thank you all for the attention.
Well done, Lisa. 10 seconds spare means 1 coffee more.
Thank you.
Sorry, I'm in a rush. Sorry. Could you speed up a little bit? Thank you.
Good morning. Thank you for the talk, really interesting. I'm Irene Di Giulio, King's College London, here thanks to the Physiological Society. It's not a walk question, I promise, but why all males? A neck cancer patient?
Yeah, because head and neck cancer is very prevalent in old males. So that's why. Also, we are recruiting stage 3 and 4 cancer patients. We will have the pleasure to test the first female on this project next week.
Okay, good luck then.
Thank you.
Hello, Ole Christian again from the University of Malta. You were very clear on the compliance. However, you're giving a therapy, and you weren't very clear on what the therapy is, the dosage of the exercise, the intensity, and so on. I think it's very important to know.
Yeah, thank you for your question. Are you asking me which kind of therapies they are undergoing? Okay, great. So the patients you saw, so for these 11 participants, it can be either surgery or chemoradiotherapy. The exercise, okay. So the strength sessions is the resistance training. It's 10 exercises, 3 series for 10 repetitions. And we are trying to stay above 15 on the RPE scale. While for the endurance exercise, it's very personalized, and we're using the core scale to personalize the intensity. And during the in-person sessions, we're doing interval training. So we're doing like 5 minutes above 15 and then 5 minutes for rest. And while at home, we're asking them to do any kind of training they want, which is endurance. So they can walk, they can cycle, they can swim before they put the peak line in, and so on. And we also give them a Fitbit activity tracker to track their heart rate, and we ask them to watch the work scale at home and tell us how they perceive the exertion.
Quick question.
So thank you, it was a very interesting presentation. And may I ask you some backstage questions, because I've studied in Pavia and I have fond memories of Maugeri Institute, and they are quite famous for rehabilitation too. And I was wondering if you can't do the exercise therapy also during cancer treatment or after surgery as well.
That's what we're trying to do. So after they start treatment, we still invite them to keep training. We still ask them to stay active, also at home, also before and after the therapies. Not all of them are accepting this approach. So the guy that you saw in the last picture was actually training during the whole process. So when we have enough participants, we will be able to see how the results looks like also with training during the therapies and before.
Good luck.
Thank you.
So, first technical issue for us, more question for her. So, one more. I will keep it with one. Bravo.
Do you know at the last time point how physical exercise your patients do?
That's a problem. Yeah, so not for the patient we recruited so far, because at the beginning we didn't have the Fitbit, so the guys who have already tested at the last time point, we don't have the data, but the Fitbit we're giving them will stay with them until the end of the project, so we will be able to know a little bit more about what they're actually doing in the 6 months. And also how the activity is changing from immediately after the end of treatment to 6 months.
Okay, thank you.
No worries. Thank you. We can continue discussing. In the view.
We have the second issue. Now it's better. Thank you very much.